Welcome everyone to the People's House.
Mr. Speaker, will you please call the House to order?
The bill is passed.
We want to make sure that we make New York a more affordable place to live, a better place to raise a family.
Welcome to Assembly Update. I'm Assemblymember Angelo Santa Barbara, representing the 111th Assembly District, which includes parts of Schenectady County, parts of Albany County, and Montgomery County. And today we're going to be talking about the Salvation Army. We have joining us the director of the Salvation Army for Schenectady County. He's going to talk about Schenectady County and the Capital Region. We have Major Michael Himes. Welcome to the show, Major.
Thank you very much. It's great to be here.
Thanks for being here. It is the holiday season. We all know the Salvation Army is around, and we hear the bells when we go to various locations. But we want to talk about some of the programs and some of the things surrounding the Salvation Army.
Great, glad to do that. Yeah.
What are some of the? I guess let's start off with the origin of the Salvation Army. When was it founded? And give us a little background information.
Well, the Salvation Army started off as a mission to the East End of London's poor. Dickensian England, people working in terrible circumstances, terrible poverty, and children working long hours, child labor problems, and so forth. And a young Methodist minister and his wife, both of them probably equally, founded the Salvation Army, William and Catherine Booth, and they started ministering to the poor. They were originally called the East London Christian Mission, but then at one point they took on the form of the military just for organizational terms, organizational purposes, and the general was the founder was affectionately called the General, and so they began to don uniforms because going into the slums and so forth, they were easily recognized, and people knew that they were friendly and could do good things, and that was in 1865, and the Army is now in about 127 countries around the world.
And certainly you have a fantastic mission. We see every year around this time, we see the Salvation Army is at various locations. It's been around for a long time. What are the programs? When we throw the money in the buckets or when we make donations, for the audience, where does that money go? What are some of the programs we're benefiting?
Well, first and foremost, the money that goes in at Christmas takes care of our Christmas effort for distribution of baskets, food on Thanksgiving Day, food on Christmas Day. We actually feed about 350, 400 people on Thanksgiving Day who are shut in, the elderly. And then on Christmas Day, the very same thing. We have volunteers who come and cook, and it's an assembly line. It's a great time. People are on their holiday and they're doing all this, so it's wonderful. And then we give away Christmas baskets to needy families and Christmas toys to children at Christmas. And of course, it's a complete holiday sort of a effort, including Thanksgiving, Christmas, and New Year's. So first and foremost, it goes to that. If there's any left over, then that would go to things like putting gas in the vehicles to drive the folks out there to ring the bells and all those kinds of overhead sort of costs. So it's a big time of year for us. We raise a good portion of our budget during this holiday season.
And I know we mentioned you are the director of the Schenectady County Salvation Army, and I have a list of programs here. There's a feeding program, there's youth programs, there's women's programs. There's a lot of other things that surround the Salvation Army the rest of the year as well.
Yes. One of our ongoing programs is 5 days a week. We feed approximately 300 people at our Salvation Army Center on Lafayette and Smith in downtown Schenectady. And that would be about 100 plus at breakfast and maybe just under 200 at lunch. And so people come 5 days a week, Monday through Friday. They can get breakfast and lunch at the Salvation Army. And in addition to that, we have an emergency food shelter where folks can come and get food, enough for 3 meals for 3 days for whatever size their family is. And so those are two of the very important food programs that we have. We also give away coats. I gave away 2 coats this morning before I came. We give away coats to people who are in need of them. As they are donated, we give them out. We have programs which help people with various needs they might have, including counseling to a certain extent. We have a social services director there. And then we have youth programs where we do things like involve kids in character building programs similar to Boy Scouts, Girl Scouts, and they are helped out at the Salvation Army with volunteer leaders who do these programs. Athletics and music is a big part of our Salvation Army program. We teach children how to play musical instruments, and they continue on for the rest of their life. Recently, the principal of the New York Philharmonic retired, and he learned at the Salvation Army, principal trumpet player of the New York Philharmonic. And all around the world, you'll find that music leaders in major symphonies are Salvation Army kids who grew up learning to play instruments.
Those are the Salvation Army musicians? Is that what they're known as? Or
Yes, yes.
Okay, and they participate in various events?
Right. For instance, I started learning when I was 6 years old. My folks went to the Salvation Army for church because we are also a religious organization. That's what we were founded on. Basically, our mission is to meet people's needs without discrimination in the name of God, in the name of Jesus. And so we do that, and that's our religious basis. Without that, we wouldn't probably be. And we are all around the world known for that. But I learned at 6 years old, and I've been playing for almost 50 years now.
Well, we'll have to hear that at some point next time I visit, maybe. So there's a lot of programs that are surround the organization. Getting back to the holiday season, the Red Kettle.
Yes.
So this is what we see. This is what people see when they go shopping. People are able to contribute during the holiday season. What was the inspiration? What was the thinking behind the Red Kettle program?
Well, you'll recall near the end of the 19th century in San Francisco, there was a major earthquake. And one of the Salvation Army officers there put a pot on the pier for ships and boats that were coming in. And it said, this is for assistance of those who were hurt by the earthquake. Keep the pot boiling. So it was an easy way for people to throw money in the pot.
I see.
And now all around the country in movies and television, the Salvation Army kettle is recognized as a way to help someone at the holiday season.
It is, and it is very recognizable. And I think when you mention it, Salvation Army, that's one of the first things you think about. And obviously there's many locations, and there will be many locations this year as well. You're having your kickoff.
That's right.
The
Capital Region Kettle Kickoff is tonight at the Cross Gates Mall, and we'll have some musicians playing there.
Okay.
I'll be playing my horn, and our regional director, Major Roger Dupree, will be there, and it'll be a big kickoff.
And how many volunteers does it take to run the Red Kettle program? Is it as many as you can get, or is there a certain number of locations available?
It's as many as we can get, because with all those locations, of course, we've got about 35 days that we actually ring.
Yep.
So, the Rotary Club may ring one day, and a church group may ring another day. Individuals, such as Assemblyman, may ring on another day. So we do have those opportunities for anybody who's interested.
Well, I did ask you before the show. I am interested in ringing the bell, so you may, for those of you watching, you may see me at several of these locations. If people watching want to volunteer, they want to help ring the bell or volunteer in some other ways, how can they do that?
They can do that by calling the Salvation Army. And if they'd call the Salvation Army in Schenectady, we would be glad to direct them to whatever community they may be in, because the Capital Region entails Saratoga Springs, Gloversville, Troy, Amsterdam, Schenectady, Albany, and even as far north as Glens Falls. So if anybody is, and down in Hudson, I should mention, if anybody's interested, if they call the Salvation Army, would you like me to give the number?
Yes.
It's
yes,
518, of course, 346-0222, 346-0222. And we can direct them to the correct place to volunteer.
And it's not just around holiday time. It's all year long you look for volunteers.
Yes, we do. For our feeding programs, we have various groups that come. Today, the Knowles Atomic Power group is there feeding lunch. Kiwanis comes in, Kiwanis Club comes in, and various church groups, many church groups and synagogues and so forth come in and volunteer and feed lunch. They do everything from cooking to serving to cleaning up, and then they do that once a month. So it's not a burden on them. It's a great opportunity.
And we just talked about volunteers. Is that a challenge to find volunteers, or do you have enough to get through the year? What are some of the challenges you're facing, going forward, or you have faced in the past that you've been able to overcome?
Well, we're doing pretty well with volunteers in Schenectady. Some locations have difficulty finding them. One of the big times we really need volunteers, though, is during the kettle season, the bell ringing season, because it's so cold in upstate New York.
It does get cold here, yes.
Typically, you would alternate, take 1 hour shifts. One group might take 1 hour shifts. It's a very good time to volunteer is around the holiday season. It's probably the most needy time of year. I did want to mention to you, though, that when we were talking about volunteers and ways to help out, we have other programs that in the Capital Region. We have a rehabilitation center on Clinton Avenue, which works with substance abusers and helping them to get clean and to live a productive life. We have a women's shelter in Schenectady on Lafayette Street as well, and it's women and children who are there, 21 beds, and of course our thrift stores that people go to, and those go to support our rehabilitation program for men in the Capital Region who are struggling with substance addiction.
And I know you've always taken donations as well as you mentioned coats,
yes,
and clothing. And where would are those picked up, or would people drop those off at a location?
People would drop those off at any of their Salvation Army locations around the Capital Region, and they'll make sure they get to the right people. And
that's something, again, not just around the winter months, but maybe all year long.
Yeah.
You accept those donations?
Sure. Clothing is always helpful, and we do make sure that anybody who comes in who needs gets. Typically what we will do is actually send them with a voucher to the thrift store saying, give them this or that, because it's all sized, it's all racked, and they can pick it right off and make, and with some dignity, because nobody knows they're getting a voucher to the place for free there, but they get it, and it's a wonderful way to serve people.
It sounds like a great system. And also, the food pantry we mentioned.
Yes, we have a food pantry which gives out food, and we receive donations of canned goods at many times during the year. And this year, as I say, we'll probably be helping at Christmas about 500 families with food baskets. So that's a big deal.
And I know there's plenty of other programs that we haven't covered, but if anybody's interested, they can call the number or they can find you online. I want to thank you for being on the show. I'm looking forward to joining you this year, helping to ring the bell.
Great.
And for anybody else, that number again that wanted to volunteer
is 346-0222.
I want to thank you for being on the show. I encourage you to participate this year if you can. We are going to take a short break here on Assembly Update, and we are going to join you again, and we'll have for the second part of the show. Thank you to the Salvation Army. Thank you for what you do. Thank you for expanding and having all these programs available in Schenectady County and beyond. Certainly, it's an important part of our community, and I want to thank you for your efforts as well.
You're welcome, and thank you for having me on.
Stay with us here on Assembly Update.
Looking for these? You drive buzzed. It could be one very expensive ride.
First, you gotta make bail. Then pay me to get your car back.
Your insurance premiums will go through the roof.
And my legal fees just keep adding up. All told, it could end up costing you $10,000.
Buzzed, busted, and broke. Because buzz driving is drunk driving.
So, I'm kind of new here, but I've noticed a trend. My human does this funny thing where she goes around and gets all my toys, and then she hides them in that basket by the door. But it's always the same basket, and it's always in the same place. And then she acts so surprised when I find them, but, she's putting them in the same basket. Again. It's like, hello? That's where you put it last time. You were the worst at hide and go seek.
Everybody has a dream. Mine was to see the ocean. And with a little help, I made it.
Every budget, so don't accept defeat.
Now you can get covered and still
buy me treats.
You take care of your pets. Now it's their turn to take care of you. Visit getcoveredamerica.org to learn about your health insurance options.
Welcome back to Assembly Update. You can find me on Facebook or follow me on Twitter under ASM Santa Barbara, or find me on Instagram under Assemblyman Santa Barbara. My district offices are located at 1170 Riverfront Center in the city of Amsterdam. Phone number there, 518-843-0227. In the city of Schenectady at 433 State Street, Phone number there, 518-382-2941, or by email at santabarbara@assembly.state.ny.us. Welcome back to the show. We have joining us now for the second half of the show, Karen Laing, who is the CEO and founder of Health Literacy for All, Inc. So welcome to the show, Karen.
Thank you.
Thanks for being here, and we're going to talk a little bit about Health Literacy for All. Tell us a little bit about the organization and how you got involved with it.
Well, health literacy is the set of skills that people need to navigate the healthcare system, live healthy lifestyle choices, and then respond appropriately in a public health emergency. And I started 5 years ago when I went back to college after losing my job, and I internshiped at the city mission, and they had asked me to put together a program to help their people navigate the healthcare system. And out of that, I drew a deep desire to see people really be able to do it well. So part of that was launching my own business and doing that. And my Health Literacy for All is a not-for-profit, so it's great. You can make donations directly to there. I can go after some federal and state grants to help provide that for low-income people, and then as well, we teach classes out within the community to everybody who wants to know how to navigate the healthcare system better.
And it seems like it's something that's not easy to navigate. So it's a.
It's not. The problem really is that we've never taught the skills to patients and to people who use the system before. We've known that this is a problem in the public health field for 40 years. And we've addressed it from the provider side, using translators, easier to read publications. All of that is also included on health literacy. I focus primarily on making sure people who use the system can use it, as opposed to making sure providers can speak well to their patients.
Now, your clients, sort of people that come to you, are they from, I know, are they pretty much every type of, is it
all
families,
walks of life.
Seniors,
yeah.
is it
I
teenagers?
I do some classes right within high schools and elementary schools, all the way up to senior citizen retirement communities. Businesses hire me, not-for-profits do. So anywhere where you can gather 10, 15 people and they want to know more about health and healthcare, I can definitely come and teach there.
And I just recently saw you at Schaefer Heights, and you were talking to seniors about emergency preparedness as well. So there's certainly a lot of presentations that you do in the community.
Yes.
I guess how can people access, if people have questions or want to access the services you provide? What's the best way to do that? Would they say when would be the right time to do that? I guess
the right time is as soon as you feel led. You've got a complication. I do work occasionally one-on-one with individuals as well. So if you have a family in crisis, I can come alongside and help put you in connection with proper resources. But for just general classes, my website is great, healthliteracyforall.org. I'm also up there on Facebook and Twitter and LinkedIn and all of those kinds of things.
Yeah, we've seen you on all those social media.
Yeah.
before you came on the show. Yeah.
I try to make it really, really easy. You can also call me or text me. My phone number is 518-881-6405.
So I guess there's several different parts of the organization, but what is it? You mentioned health literacy. How would you define being health literate? When do you think people are at the point where, yes, you understand this and you're health literate?
Well, the federal government actually says 9 out of 10 people are not health literate, and it goes all the way down to 1 out of 33 when they're talking about mental health. So I think really everybody, there's pieces of this particular puzzle that everybody can benefit from. You either don't quite understand how to navigate the healthcare system, you don't understand how to manage your own chronic illness or to communicate well with your provider. If you get a new illness, you're not sure where to seek out appropriate treatment or how to pick a treatment. Doctors really don't. We're not back in the 60s anymore where the doctor says, this is what you're going to do. You have this illness, this is what we're going to do. Now they say that you have this illness, these are your choices. And that's an overwhelming set of choices sometimes.
And sometimes it's not easy to make that choice.
And it's not easy to make that choice. And a lot of times those choices are based on your core values as well. I teach a lot to seniors with cancer, and we talk about that quality of life versus quantity in life. And do you really want to, at 85, put yourself through chemo? Or do you just want to accept that this may be the end of the process for you and go out the last few years of your life with full bang, knowing that you're not going to spend the last 2 years of your life in chemo treatments and trying to squeeze out another year of your life, which is sort of the side end of it. But we also look at kids growing up and trying to learn how to navigate their own healthcare choices, and teens with autism especially. Can they get to college? Can they move on with their life without the supports that were there in high school? How do you navigate and manage your own health care? So it works on both ends of the spectrum. And everybody's got a little bit of something they can't quite handle, is my general opinion. and sort of the federal level's opinion as well.
Well, and these are the, I guess these are questions that everybody has, and I have a child with autism as well, so these are questions that have crossed my mind as well. So it's very important. I think it's a very important thing to be, health literate and to know what the choices are and how times have changed. My next question would be that, and you mentioned children. How does it change when you're a child? When you're growing up. How does that change as you get older? Your choices and the decisions you're making to becoming an adult.
My goal when I teach the children is to try to start getting them and their parents as well to accept the fact that, especially if they have a chronic illness, that they need to own that illness. We see over and over again kids with chronic illnesses hit the college age and not care for themselves. And so you see diabetics and epileptics and kids with some mild drug or drinking problems who will kill themselves in college from not taking care of themselves. I have a very close personal friend whose niece died last year of an epileptic seizure in college. And, being able to accept that diagnosis is not something your doctor did to you, it's not a condition your school fostered on you, it's not something your parents have said, this is my illness and it's my responsibility to take care of it, helps them to get through those early stages where they're really on their own trying to take care of it. And we really don't do that well at all, and it's a huge disservice to our young adults.
And getting back to the services, what the organization does, a health literacy class. If someone were to contact you, what would that consist of? What are the variations of things that could happen?
There are lots of variations depending on your needs, but for the majority, people use me for a 1 to 1 half hour course specifically on certain topics. So, I'll go in and talk to teens maybe once about how to pick health insurance or how to use their health insurance as they go to college. Come back a second time and maybe talk to kids who about how to access resources on a college campus as a second class. And then talk about, what do you need to do as a third class to maintain your chronic illness control? How do you make sure you've got the right medications, that you can get your medications at college that you didn't do at home? How to communicate well with your doctor when your mom's not in the room anymore, those kind of things. So most classes are broken down into smaller segments where you're still getting all of these trainings and all of the information you need, but in smaller manageable chunks focused around a particular topic.
And obviously that would be different than, say, if seniors, the seniors we talked about some of the medications and people losing their prescriptions.
Right. So when we do the emergency preparedness now, I also work for the Red Cross and on a volunteer management position. I don't teach their classes because I try to teach emergency preparedness from the side that you have a chronic illness or you're sick, and it makes it so much more important that you really are emergency prepared. And that you are communicating well with your family in that process to make sure that you're covered. So you know where your medications are, you know how to contact your doctor, you're prepared if you have to evacuate, all those kinds of things.
And and it was interesting to hear, especially with seniors, that if you are evacuated, you're going to a different location. The doctor may not be available. Is there something?
Yes,
available?
If you have a really, even at the younger age, if you're dealing with cancer or type 1 diabetes or a more rare illness, where do you go to evacuate where you're still going to get good medical care. It's not just enough that you get out of the way of the, the tornado that's coming through New York City. You got to be able to be someplace where you can get treatment at the same time, from good quality care treatment. You don't want to be in a small town hospital that you're the first person they've ever seen with that illness, and they don't really know how to handle that.
And these were, these were questions that really, started a lot of conversation, and people started thinking about it. So,
right. Yes.
It's great to see, to have you in Schenectady and to have this the health literacy for all. What do you think? What do you think of some of the challenges coming up? Is there something for parents to be able to come to you and then they can go back and prepare their children, or some sort of?
Yeah, we can do classes for parents. I often do those right through a school district, but I could do those in other directions as well. Any place where parents gather and organize together. Girl Scouts, maybe do a parent class for a Girl Scout troop, something like that. And I do want to mention that I do go outside of Schenectady as well. I go.
Yes.
Right now, I travel from Glens Falls to Poughkeepsie, but I'm pretty much willing to go anywhere to get the information out.
and you did mention autism, special needs as well.
Right. Yeah, a lot of special needs. It really is for me, especially on the kid side of it. I want everybody to be able to use the system well, but I really want kids who have learning disabilities and chronic illnesses to be able to do that well as they get on their own a little bit more. I think that's really freeing for the parent, too, to realize that they don't have to worry about their kid for the rest of their life, that their child will know how to use the system well.
And we talked about how it's difficult under normal circumstances. With special needs, it's even more difficult to navigate the system because it's something that's it's new and it seems like it's more complicated.
Right.
And it is, as parents, you want to find where resources are, where information is available, and that's something that you can offer as well.
Yeah. Absolutely. I can help parents to tie into any of the resources that are available if their kids are heading off to college. What does that, take a look at that college healthcare system. What's there? The University of Albany right here used to have all their healthcare facilities right on campus, and now kids have to get on a bus or a van and go down the road. Well, that's not bad if they've got a cold or a flu, but if they broke their leg, it's a little more difficult to navigate. So, but at least being aware of what's out there and what's around and what might work. And sometimes that's a deciding factor in picking a college.
Sure.
Is not just the educational support that you can get, but if you've got a child who's struggling with an illness, can they handle medically that illness with on the campus facility well?
Something to think about, absolutely. So Karen, you can be found on LinkedIn, on Facebook, and on Twitter. So if you want to know more about health literacy for all, find Karen on social media or your website. Or by phone. I know they're flashing up the information now.
All that fun information, yeah.
And certainly they can stop in at your location as well. You're in Schenectady on Jerome Avenue.
Yes.
It's 1908 Jerome Avenue.
Yep.
I want to thank you for being on the show and for sharing all this wonderful information.
Thank you.
I encourage you to take a look at the website because your website has
it has all the list of classes that I offer, and I'm constantly redesigning new ones as well. So if you have a concern that doesn't seem to be addressed on there, let me know, and I can come up with a class that will help you to meet those concerns and those needs as well. That's where most of those classes have been driven by to begin with.
Well, thank you for what you do, and I'm sure I will see you again at one of your classes soon. Join us again here on Assembly Update, where we'll talk more about organizations. They're doing great things in our community, like health literacy for all. Thank you, Karen. Thank you for joining us. Join us again here on Assembly Update.